There's a lot of uncertainty around a lot of things. But amazingly, with all of the fear mongering and everything that's going on, there's not a lot of talk about healthcare. Why do you think that is?
Well, there really never is. We all kind of come to accept that healthcare is incredibly expensive, that it's cumbersome, that it's inefficient, and yet we have some of the best. We really have some of the best healthcare in the world. Right. People will criticize it for other countries, but then they'll come and they'll rent out the whole floor of the Mayo Clinic.
Of course.
Or come, and 30% of my practice is international.
Right.
And so why is that? Well, because the quality is here, the science is here, but yet how it's delivered is incredibly cumbersome. And the COVID-19 pandemic has really exposed some of the flaws.
Right.
And these are things that we were talking about before. At least in my circle. Right. But now it's just starkly apparent.
Now, for someone listening, when you say orthopedic upper extremities, what would that consist of? The hand, the thumb, the wrist, the forearm?
Well, all the way to the shoulder.
All the way to the shoulder.
So orthopedics, as you know, is a discipline of medicine, medicine and surgery.
Okay.
We treat a lot non-operative, obviously. So medicine and surgery, that deals with the musculoskeletal system. And that's pretty wide range. For my case, I'm an upper limb surgeon, which means from the fingertip all the way up to the clavicle and even what we call the brachial plexus, the nerves that come out of the neck.
Okay.
Once I think it's a neck problem, I call my buddy who's more expert in that. But other than that, we do the whole thing.
Now, is this how relevant is what you do to the grand scheme of things?
Well, very relevant, because in particular, upper limb orthopedics hand surgery is incredibly important to society. Because most of us work with our hands, right?
For sure.
Yet, we give a lot of attention to, our star athletes, and most of them, what they do, they tear their ACL.
Yeah, for
sure. So the average person knows a lot about that, and they don't know about hand injuries. And, being here in Miami and South Beach, people say, "Oh, you're a hand surgeon?" At a cocktail party. What do? You get rid of wrinkles on a hand?
Yeah, because they think of everything else, cosmetic.
It is amazing. You gotta love Miami.
For sure.
And I go, no. I'm the guy you want to call if you're working in your garage with a circular saw and you put your hand into it. Wow. And then right away they
wake up.
They get it. Yeah. So it's actually an incredibly diverse specialty.
Right.
We do everything from congenital, birth deformity, all the way up to arthritis. Trauma, athletic injuries for sure.
Right.
You don't want to go to the famous sports medicine doctor because they really do. They know what they do is knee and even shoulder, but they don't do hand and wrist and much elbow. So it is a very diverse specialty, and I was inspired to it because of my grandmother who had rheumatoid arthritis. Okay. Really crippling arthritis, and in New Jersey we went to Columbia Presby. Okay. At the time, I didn't know who the doctor was. Of course, I was 8 years old. Right. And I'm sitting there in this office, my feet are dangling, and I looked around and I said, I could do this someday. Yeah. Because I really love my grandmother. Wow. And she's an immigrant from Valencia. So when we came from Cuba, she had grown up in Spain. Okay. And she developed rheumatoid arthritis. And then little did I know is that 25 years, 30 years after that incident, I would be training with one of that guy's disciples in Pittsburgh. I think that, and I talk about it in my book, is that experience really crystallized a decision for me about what I wanted to do.
That's amazing, especially for anyone listening out there, if even children are listening to that. When you painted that picture at 8 and said, look, I can do this. And look at you now. I mean, you've built your reach within this field is so vast. Could you tell them a little bit about that? I mean, you have international travel connected with this. You built a research. What about your research institute in Miami?
Well, what it is I'm a co-founder of a cadaver lab, meaning that we run courses there. Okay. Because certainly you can read. Now everything's on the web, but especially if you're a surgeon, hands-on is key. Yeah. And you don't necessarily want to do that first time you've done that technique on your patient. So you want to do it. So you want to do it in a lab that's and it's state of the art. There are a number of these around the country. Ours is, I still think now is the second biggest in the world. Wow. I think the biggest is in Bangkok. Okay. So these courses go on all the time. Right. Of course, now we're struggling as well, and we're doing a virtual learning right now because that's struggling. But that has allowed me to really meet surgeons from all over the world. But we do everything there. So I don't go that often because I'm only I'm a hand guy.
Exactly.
Yeah.
Now, I'm going to ask a very, for me, it may be a crazy question. Can someone get a general hand injury, like the spine can be impeded a little by working at their desks every day and holding their hands the wrong way on the keyboard or not having the right chair? Is there possible to develop some type of issues within that?
The simple answer is no.
Okay.
There's a lot of myths about this.
Right.
These computer diseases. What happens is there are certain things that are extremely common. Okay. Extremely common general population. And many activities will simply aggravate symptoms. Right. So there's a difference between aggravation and causality. Right. Okay. And this is a big challenge I have. And I talk about it in my book, how the legal world is seized upon this. Right. I see lots of industrial injuries at work. Those guys deserve, not only to be treated, but probably a check at the end, right? For their trouble and life-changing. That's not the case with, say, the most common thing any hand surgeon treats is carpal tunnel syndrome. Right. That was around long before Steve Jobs. Understand. Okay, long before. It's a pinched nerve in the wrist. Right. But certainly if you use a keyboard and you're holding your wrist in a flex position for a long period of time, you're putting pressure on the nerve. Got it. And that's called the Phelan's maneuver. Okay. And you're just recreating that. Right. But of course, anything where there's an economic benefit from it may be exploited. And that's sad. And that leads to our increased healthcare costs, for sure. And that leads to a very, very solid point. And that's what I really want to discuss. So the first question I have for you regarding that is, one, you've mentioned you wrote a book, and we're going to talk about that. It's in the works now. And that's pretty almost done. Thank God. It's almost done. And I believe you're courageous in a sense for touching this topic. But the first question is foolish comes to mind. Hey, renegade, huh? Yeah. U.S. healthcare crisis. Yeah. Are we, in your opinion, under a U.S. healthcare crisis? Yes. Are we experiencing it? Yes. Why? Because we keep talking about the uninsured and about the lack of access and inequality to healthcare access, and some of the markers show that we're certainly not where we should be, considering our expertise, and part of it as the incredible waste in the system. Right. The bureaucracy has gotten completely out of control. And the problem is the people talking about it, if you think about the sort of the talking heads in the media, when are they doctors? I mean, now we're hearing from Sanjay Gupta and Fauci every day. Every day. Every day. But you know what? Those guys haven't been in the trenches in a while. And I really respect, Fauci, I was at Bellevue during the AIDS scare. I would have my hands this far in somebody's abdomen who's HIV positive. Imagine that. I did, we didn't know how, and fortunately it's not quite as infectious as we think. And even the virus, but a guy like Fauci was already at the forefront. And that was a long time ago. Yeah. So the problem is that we're not hearing from the people who are really delivering the care. But yet the pandemic is bringing that, because all of a sudden we're talking about heroes without capes. Yeah. So I see an opportunity here. Right. Where this unfortunate, sad pandemic obviously from a loss of life, but also an economic view. Yeah. I do think that there's going to be something that some of us are terming healthcare 3.0. Yeah. Where there's going to be a shift in healthcare delivery that'll be a lot more efficient, a lot more outpatient based. Okay. Hospitals are always scary places. Yeah. I've said this before COVID. People have heard of MRSA. MRSA is methicillin-resistant Staph aureus. That is a really bad bug. Bad, yeah. Okay. So hospitals have their place, of course. Okay. But we don't need to treat everything there. And the problem is you don't hear this on the airwaves. Right? No. You don't hear people talking about this. Yes, now we're starting to see people interviewed or intubating. Right. To me, they're my heroes. I'm a little guilty. I feel like I was an ER doc in Manhattan. Okay. But I haven't done that in 30 years. Right. So I don't have a place being there. The people who really deserve the praise are the ones now who are in the trenches. Absolutely. And putting their lives at risk. My friend's a shoulder surgeon. I skied with him right when all of this was breaking. I was in Italy. So I got out of Dodge just in time from Bergamo. I flew out of Malpensa in Milan, and he's a shoulder surgeon. He told me last week that 110 physicians have died in Italy alone. That's directly related to their exposure. Directly related. Yeah. Listen, there's no doubt that something's going on, right? Something serious out there.
having said all the things you said, I think it's a valid point to say that a lot of the narrative is being said by the uncaped superhero. I love that you put it like that. But what is the real expense of a flawed system? Like what happens to the people if the system remains flawed?
Well, there's a number of things. One is waste. I mean, in writing my book and preparing it, which by the way is more anecdotal than anything, because I think people need to understand what the problem is.
Right.
I wish I was smart enough to write something that had a ton of statistics, but I do, insert that at times with sort of real life examples.
Perfect.
For example, there's some studies that have shown that 25% of all diagnostic testing is completely unnecessary. Some studies show up almost 50% now, maybe not completely, but I'm talking about things that we do to either cover our butts because of malpractice,
right?
Because there are protocols, almost like cookbook. Right. Medicine, I tell my patients, medicine is often more an art than a science.
Yeah.
The gestalt of hearing a patient, how did this happen? When did it happen? You look at their age or demographics. You already have a working diagnosis without expensive tests. The tests are used to usually confirm, hone in, and these are things that are incredibly costly. But we're being forced into all these maneuvers,
right,
in order to just get care done.
And do you think that's directly related just to dollars?
Part of it is that, there's too many people with their hand in a cookie jar.
There you go.
And I hate to relate it to something that is the antithesis of healthcare, but it's kind of like the war on drugs. You think, why can't we resolve this problem, right? Well, there's a lot of people making money from it.
Yeah.
I mean,
a lot of people.
Yeah. So what was that film? Blow, was it?
Yeah.
Okay. So, and unfortunately with healthcare, I mean, there are more than 500 EMRs, electronic medical record systems. Now, you can criticize George W., but he was the one who said we need to have a national electronic health registry.
Right.
Okay, that makes sense. But they don't talk to each other.
No.
They don't. I just had a patient from, I actually operated on a patient. She's a general surgeon in the Cayman Islands. She's trying to refer a shoulder patient to me and wants to send me the MRIs. I said, we've got the way to do that.
Right.
But it's called I'm going to give them a plug, mymedicalimages.com.
Okay.
Right. These guys, smart guys, who said you can send that image through the cloud,
the network,
and see it. But when I deal with locally on a healthcare, I don't get that kind of interaction.
Right.
And then there's the biggest problem, and I literally call it in my book. It is a sub section of a chapter. It's called authorization is really a 4-letter word.
Oh, there you go.
Right. Because think about the concept of authorization. You're adding a whole nother layer of people to approve something when they don't understand the problem.
Yeah.
What's the thinking? Oh, unscrupulous doctor may overorder this test. Well, you know what? Weed out the bad doctors.
That's true.
That's not hard to do.
Yeah.
The person who orders an MRI or does surgery on every single person with knee pain, that's a problem. Then you look at them.
Yeah.
Kind of like we should be doing with screening at airports.
For sure.
Right?
For sure.
We throw billions of dollars to something where, you don't need to screen they made my 90-year-old grandmother get up out of a wheelchair and take her shoes off.
Yeah.
Her feet were 90 years old. Does that make sense? And that's what we're doing with healthcare. We're literally every step of the way, the insurance companies are making my staff jump through hoops.
Right.
So it means that I have 10 employees for a single practicing hand surgeon, whereas colleagues of mine in Europe might have 3 or 4 people.
Exactly.
So then we wonder why per capita our healthcare is twice as much as Norway, and I've done surgery in Norway.
Right. In
a little fishing village I've been, and seen it, an excellent level of care. Wow. They just don't have all those. And unfortunately, kind of like our fast food, they're also getting bad habits from us.
For sure.
Europeans. I talk to my South American colleagues, and they're having a lot of the same complaints now.
Listen, for you to be a doctor and to have your status and to have your repertoire of what you've done and to say this, I think is highly commendable. And I'm sure that's what inspired you to write a book. The name of your book is going to be Healthcare from the Trenches, correct?
Right.
Okay. Having said that, and perhaps your book is a part of this solution, how important do you think healthcare education is right now for the average citizen?
Vital. And I think that people, for example, Governor Cuomo, tremendous job educating people about this. And we need that about all kinds of things.
Right.
We need, so one of the core principles of when we developed Ortho Now, the concept of a walk-in orthopedic center, is to educate the patients and the referral sources.
Right.
Now, understand that some of the primary doctors know about as much about wrist or shoulder pain as I do about the eye.
Exactly.
It's impossible to know it. And I wrote an article about that for one of the medical journals. It was recently printed in Markets Insider.
Okay.
Imagine a financial magazine wrote about this. And I talked about the fact that we have to move towards sort of specialty walk-in clinics, because there's a huge role for primary care doctors to oversee your health, to manage your chronic disease, obviously. But the more episodic care should really be done by the right specialist. You have back pain, don't come to me.
Exactly.
I mean, yeah, I did a laminectomy when I was a resident, but that's not what I do. And yet I have a lot of orthopedic expertise. And I still will tell you, I'm not the guy to see for back pain.
Wow.
So let's channel the care the right way. Let's get rid of all the hurdles and obstacles to delivering that care.
Right.
And we can drop our healthcare bill 30%.
Now, now politicians, every time you see a new campaign or someone running for office, that's at the top of their list, but nothing really ever gets done.
Well look, it's more, I mean, I call out a number of people, and look, really smart people. Okay. Right. I mean, Marco Rubio moved his senatorial office across the street from my center.
Wow.
When he, cut the ribbon, whatever, I literally was in surgery.
Okay.
I told my anesthesia, I said, hold the next case. Don't bring him into the room yet. I want to go. I'm literally across the street.
Right.
I went there like this, and I listened to him, and he's a smart, but I have not been able to get to him. Exactly. The last time was when he was Speaker of the House, and I wrote him a modest check.
Right.
To support him in being Speaker of the House. He's got the right principles. Right. You got to speak to the people in the trenches. You got to speak
to the people in the trenches.
And so I've not been able to get to him. So when I hear the politicians speak, I say, my God, you've got to get the people in the room who know how to save. And that is not the insurance executive. That is not the big hospital system. It is really the people who are treating the patients, because we understand what we need, what we don't need, what's superfluous, what's vital, what's efficient, and what's cost effective.
Do you feel that a lot of the information is not sourced from people like yourself or similar? It's because you're going to tell the truth.
I've never been, there's all these conspiracy theories with COVID. I'm not like that. I'm a little bit naive. I'll be honest.
Okay.
I'm a little naive sometimes. I honestly think that people ultimately want to do the right thing. Right. And it's a problem I have.
Well, no, they sometimes say we're a mirror. We're a reflection. So if you're a good person, you assume that everyone's good.
Right. So I'm not that skeptical to go that far. I just think that there are people who are in positions more of power, right, who are the ones who really get the microphone.
Understand.
Now, the internet's been a real level playing field.
Right.
Right. But it also introduces inaccuracies as well. Right. If you look up carpal tunnel syndrome, just Google that. All you're going to see is kind of legal things talking about, suing your employer or your keyboard manufacturer because they cause this, common condition.
For sure.
And so it's the right people aren't able to get the message out.
Let's talk about facts. I was introduced to some facts about what's wrong with the American healthcare. I want to know your opinion, whether you agree with this or not. Americans are overpaying for healthcare.
Yes. But at a macro level.
Okay.
Not so much a micro level. And I think it's time that the public realizes that, just like a lot of other things, it's okay to pay something for healthcare.
Got it.
In other words, if people have a little bit of skin in the game, some responsibility, they're not going to overutilize. They'll select more carefully.
Right.
Okay. The person who's hopefully going to write the foreword of my book has written 2 books about healthcare. Julio Gonzalez.
Okay.
He's an orthopedic surgeon, a flight surgeon, a military.
Wow.
An attorney, and was a Florida state representative.
Very
Tallahassee.
Nice.
He ran. He lost to a trial lawyer. We thought I supported him in D.C. It's a shame he didn't get there.
Yeah.
But he wrote a book called Healthcare. Basically, it's like Healthcare Reform, The Truth.
Okay.
The Truth. And he puts it out there. And his new book is basically the argument for free market healthcare.
Oh, wow. Okay.
Saying that there has to be some responsibility
and that
people.
That's an interesting segue. So some say doctors are paid to provide a lot of healthcare, but not good healthcare. Some
degree, we've gotten a little too procedure oriented. I think that if you eliminated some of the nonsense we went through and paid us fairly for what we did, then that would diminish.
And one point of that would be stop adding all the layers. I have a very successful
practice. I don't need, when I actually enjoy when I see somebody with shoulder pain and I say, you know what, I'm going to give you a little injection of platelets that are going to activate the healing process for this problem, and you'll likely get better. And if you don't, we can always do the arthroscopy later. I enjoy that because I'm busy enough in the operating room that I don't need to do things unnecessarily. And any busy and ethical clinician will tell you that. It's the problem is that when my colleague who opens up somebody's chest and takes either a radial artery or the saphenous vein from their leg to put it and sew it into their heart and save their life, and that pays maybe $2,100 by Medicare, and includes a 90-day global of following that patient for 90 days, no matter how complicated it gets, and making rounds and taking calls at 3 a.m, and that pays you $2,100. There's something wrong with the system. The money is going the wrong place. It's being dissipated to really and I talk about in a book, a lot of opportunists, and I don't blame them. That's the definition of an opportunist.
The definition,
is that you see an opportunity. Some are ethical, some are not. But the point is there's money to be made, and the money really should be made by the people providing the care.
So do you think that brings us to my next point? Half of healthcare spending is said to go towards 5% of the population. Handful of patients use the majority of healthcare services, while millions go without even barely seeing a doctor.
Yeah. Well, there's a section in my book where Dr. Dreyfus, who's an ER physician, is actually one of the folks who purchased an Ortho Now center because in his emergency room, he saw all these ankle sprains and little wrist fractures waiting for hours. They weren't at the right place. He was addressing the hip fracture. The person had to be in the hospital. So he saw that a lot of his time was wasted by sort of these recurrent people, what they call doctor shoppers, people seeking, narcotic. And instead of treating them more efficiently, we allow this revolving door that consumes the healthcare resources. Now, that's also, we have to make a hard decision as a people. Is should we really spend almost half our healthcare on the last 6 months of people's lives? Once the quality of life is eroded, I mean, do we really need to put everybody on a ventilator? Where you can see we had issues getting ventilators for younger people who are getting sick from COVID. And I'm not saying that we're making decisions to play God, but at some point we have to really look at it, think about it hard. And I'm not the person to do that, but I just want to put that out there to think about it.
Healthcare from the Trenches, the book that you're currently working on. You spoke a little bit about what inspired it, but what can the reader look forward to in that book?
Understanding what the people who deliver care go through, the challenges we have, and consequently, that's what makes it so expensive and so onerous to access. So what they can expect is that the first third of the book, and you touched on this, goes sort of through my journey because I want the reader to identify a little bit with a typical physician. And it's a long journey. No regrets. I would do the same thing all over again. But it's hard to recommend it to my children with how it really is. So the first third goes into my, really from my childhood all the way through my medical school, residency, hand fellowship training, and then going into practice, which is still part of learning. Very true. First go into private practice. It's
called practice.
Yeah, exactly. So we go through that, and then we get into the second where we talk about categories of issues that affect healthcare: government, insurance companies, big hospitals, and healthcare systems. We go into that. Then we go into gets a little ugly. We get into the opportunists, the scavengers of healthcare, whether it be the ambulance chasers or the people who are selling snake oil.
There you go.
They use, all the time, and then the 300-pound gorilla, which is malpractice.
Oh man,
which is malpractice. Which every clinician is under the gun with that constantly.
There was a study. One came out in 1999 that spoke about maybe close to 100,000 people in hospitals die a year due to error. And then several years later, that number was revised to almost 500,000 due to error. And that
I have a little bit of a problem with that. I've heard that. In fact, one of the experts on this is actually here in Miami. And in fact, he's a patient of mine. And he didn't coin the term, I don't think, but patient safety. Right. I don't like it because it makes us feel like patients have to be wary of us. Patient safety. It's kind of redundant. We're here to keep you safe.
For sure.
It doesn't mean errors don't occur because we're human beings. And yes, we need to design protocols that can minimize that. But part of it is the complexity of healthcare. And I'm talking about unnecessary complexity that allows those sort of things to happen. If we could focus on what's important, what's cost effective, what's good for the patient, a lot of those errors would be diminished. I am absolutely confident of that.
That's incredible. Final words. Where are we headed?
I think we're heading towards a different, we're calling it healthcare 3.0. Right. There are a number of people out there who are talking about this very, very vocally. That there's going to be a reset, and I think you're going to see it in many industries, but obviously healthcare, because it is a viral healthcare pandemic
for sure.
And I think we're going to see that outpatient and ambulatory care, not only is it more cost effective, but in many cases there are less risks involved, just because hospitals obviously have infectious disease issues naturally. Ortho Now is kind of a model for that. What's interesting is that we started this 10 years ago, and Ortho Now is simply a walk-in center for any orthopedic care. It turns out that 70%, our extensive data analytics shows that 70% is not even urgent.
Wow.
It's literally people saying, boy, my knee's been hurting me for a while.
Yeah.
I can't get an appointment with the orthopedist. I went to the general urgent care and they told me it was a sprain and they gave me some pills.
Yeah.
And so what happens is people, they need the right care. So we started this 10 years ago, and we think that the era is appropriate for it, because we've been around a while and it has been very hard to get the insurance companies to listen, the big employers, the ones who pay for healthcare, our municipalities.
Wow.
It's been a real challenge. We spoke about that even in Miami Beach, Miami, the county.
Yeah.
Even in my home city where Ortho Now was founded, if a police officer in the city of Doral got hurt tomorrow, I guarantee you he would not be coming to us first. That's a problem.
That's a problem. Yeah. I have to ask this question. You mentioned earlier that you kind of look at the good in things and you're not, really into the negative side of things. There's a saying that medically, we're going to have a dark winter of some sort, that the coronavirus, the COVID-19 will, in a sense, when the cold weather comes, metastasize into something much worse. Do you believe that, just as a person?
I think I'm concerned about relaxing the distancing a little bit too soon.
Right.
But you got to ask Tony Fauci that. They're the experts, and it's like that in everything in healthcare. I cannot pretend to have an opinion. I think that really holds a lot of water.
Absolutely.
Epidemiologists understand this better. It's funny because I write a little bit about this in my book. So I've studied some of the black plague in the 1300s wiped out a third of Europe, 75 to 100 million people. So we've been through things like this before. Yeah. We will get through it.
For sure.
I am an optimist. So that can be, good and bad, but sometimes it's important to think positive.
Absolutely.
You have to be smart about it. But I do think we have to more critically look at what solutions there are out there.
Absolutely.
To provide care. And, a month ago, an article came out where I talked about how providing orthopedic care is going to be a challenge now, because if you go to the hospital, you may get ill.
Right.
But also people who avoid the hospital, older people at all costs. What's happening to them when they have an injury? And I have stories for you just from the last few weeks of people. I did this in an amputation on a lady from a nursing home, a diabetic who had a osteomyelitis, a bone infection.
Okay.
That, if we caught it early, it would have been different.
Right.
I mean, she's in her late 80s. It's not the end of the world.
Right.
But, I had to do an amputation on her. And that's because these folks are avoiding the hospital. So we have to just have a reset about how we deliver healthcare.
Listen, Dr. Badia, you've been a wealth of knowledge and information. I'm looking forward to your book. I love that you touch on this multi-dynamic discussion in the book.
Yes.
You give a little bit of your story. You've been in the trenches, and I know we didn't touch on that a lot, but just share really quick before we go. You've done some international work. I think I've saw some stuff in Ghana. Am I correct or incorrect with that?
Yeah, well, one of my hopes going forward, particularly once we find a strategic partner, Ortho Now, because the problem with Ortho Now is it's been 10 years and it works very well. Right. But in healthcare, it's very difficult to grow something big when there's one main clinician behind it and a good team. So once that happens, then I can focus on my practice. And then I literally want to go probably quarterly and do a mission. I want to give a plug for a group called GCOM. So Gruppo Internazionale Chirurgia della Mano is started in Italy and Switzerland, where they do missions, kind of like Operation Smile.
Awesome.
And I talk about Bill McGee in my book. I had the pleasure of having a beer with him.
Nice.
Wonderful, founded Operation Smile. And we want to do that. And there are groups already doing that in hand surgery. So I hope to do that. Yes, I've been to Ghana. I've done this in Guatemala, Bolivia.
Right.
And I hope to do a lot more of that, because that is really pure medicine.
It is.
I mean, it's just the pay. And really, that's what I hope U.S. healthcare comes to. And one of the reasons I like the international patients, when the patient takes a plane and flies to me from, say, Lima, Peru, or Bridgetown, Barbados, with shoulder pain, it's a really pure transaction.
Right.
I've got this problem. I don't need, sometimes we have to deal with the international insurance company, but there's not a lot of authorization there.
Exactly.
In other words, I want, and they leave within days. Literally, they leave. They have their procedure. They leave 3 days later.
Right.
And they do well.
That's
good.
It's
wonderful to practice medicine unencumbered.
Yeah.
And that's what I hope that U.S. healthcare can get to.
Well, let's see what happens. Yeah. We're all watching the narrative and checking the movie out. And hopefully the future is optimistic and bright as history shows us we go through things and come out even stronger and better.
Sure.
So thank you for all of you listening here. Definitely go look in the links in the notes of this. We'll have contact information for Dr. Badia, some of his projects he's working on, institutions, and we will continue to update this when your book is released.
Wonderful.
So if you're listening to this later.
June 15th is the sort of proposed date.
Amazing.
Yeah.
So
Amazon, I think will open the pre-order.
Okay.
I think by Monday or Tuesday. So you'll actually be able to pre-order it, the Kindle version.
Right.
And so I'm learning. This is all a new thing.
Yeah, man.
I've written book chapters and scientific articles. This is my first time really writing something major to the public that is not about shoulder pain.
For sure. Awesome. Thank you for tuning in, ladies and gentlemen, on another episode of Be Inspired. Remember, you can wake up in the morning and make any decision you want, but always know that you have the choice to be inspired. Until next time, I'm Miguel Global, your host. See you later.